A fracture is also known as a broken bone, and I could define it as the complete or partial breaking of a bone. Welcome to the First Aider Show, a program that seeks to empower us with basic first aid skills to help us save a life, preserve life, or prevent a condition from worsening. Today, our focus is on fractures. We want to understand what really is a fracture in the medical term, and what should we do when someone has a fracture. I'm your host, Onyango Daisy Award, and joining me is Dr. James Okeyo, who will be giving us expert advice on what fracture really is. Daktari,
yes. Thank
you for being here and welcome to the show.
Thank you.
Is there a medical term for fracture?
Yeah, the way you have just defined it, but it is basically a discontinuity of a bone.
Discontinuity
of a bone. That's a fracture.
Okay.
A fracture is a discontinuity of a bone.
Meaning maybe it gets somewhere and then the bone is now discontinued from the rest of the... Exactly. Okay.
Yes.
Do you have a personal experience with fracture?
Yeah, because I work in the hospital setup, there have been seeing so many fractures. So to me personally, I've never got a fracture.
Okay, I've also never really got a fracture, so I just see people with plasters. And what really is the cause of fractures?
The cause, falling down, road traffic accident. So it is just an accident or falling down, being hit by an object, you can get a fracture. And also there are some conditions whereby somebody can just get a fracture without even falling down.
Which conditions could this be?
We know we have the tumor of the bone, cancer of the bones.
Okay.
Yes, so cancer of the bone can cause a fracture to a person. Even when I'm greeting you like this, you just get a fracture.
Wow.
Because your bone are weak.
Okay.
Yes.
And what about falling down? Is it just the normal falling down that can cause a fracture, or there is a way how someone can fall down and then get a fracture?
Yeah, it depends how you will fall down. Maybe it will depend. You cannot, determine. Okay. Yes, exactly.
And are there types of fractures?
Yeah, there are types of fractures. But fracture can be classified into two groups.
Okay.
Or we have open fracture, or we sometimes call it compound fracture.
And what is this open or compound fracture?
Open fracture is a fracture that communicates with the skin. It has the broken bone, it has communicated with the skin. Are you getting my point?
Communication
is whereby the bone can protrude outside.
Okay.
Yes, so that's a communication.
With the skin?
With the skin. But another classification, we have closed fracture, whereby the bone does not communicate with the skin, but it has broken, but it is intact. Are you getting the picture? The bone is intact, it's like a glass.
Okay.
A broken glass, but has not separated.
Okay.
Yes.
Viewer, if you're just joining us, we are very glad to have you. Today we are talking about fractures, and we've just learned that a fracture is a discontinuity of the bone, right?
Yes.
Meaning that it's broken, it's not flowing as it usually is supposed to flow. And there are two types of fractures: open, which is also known as compound, and closed.
Closed fracture.
Yes, and closed fracture.
Yes.
So these fractures, what effect does it cause to our body when you have a fracture?
When you have a fracture, there are so many things that can affect our body. We have pain. When you have fracture, there's pain. There's very severe pain. It will also form, it will impair your movement. For example, if you have a fracture of the legs, you'll not walk normally. And also there's bleeding. You will get sick. You can be admitted in the hospital. So there's so many effects depending with the type of fracture you will get.
So if you have a fracture, you can really be sick, like you can get fever and
Yes,
like
without proper treatment and immediate treatment, you will get infection. After getting infection, there will be fever.
Okay.
Yes.
And with the bleeding, since you said it also comes with bleeding, I understand for the open fracture, we'll obviously see you bleeding. But for the closed one, where it's just inside, how will you know it's bleeding?
Okay, there are signs and symptoms of a fracture, and when you are at home, you will not classify which type of this fracture is, but you know, basically in the hospital we do an x-ray that will determine whether this is an open fracture or a closed fracture. But there are signs which you can see. If you see it, the move or the leg, let me just use an example, the fracture of the leg. So the leg will not move normally. You will have that difficulty on walking. There is severe pain. There is swelling or localized swelling surrounding the place where the fracture has taken place. So that one, you know there's a problem with this leg. Yes.
And what about these conditions where they're just normal swelling? I think I had one friend, I think there was too much water that was accumulating in her foot or something. So when she sleeps, she had to like elevate her legs. Since you're saying swelling is a sign of knowing if someone has a fracture, is it all swellings, or with this swelling, yes, there will be pain? What else will make someone know, okay, this might just not be, you know, swelling that?
You know, there's a fracture and plus the swelling, you've just fallen down immediately. Your leg was normal, there was no swelling, and then you've just fallen down and your leg started swelling, and then there's pain. But you know, with other ones, this one, maybe there's a condition, maybe the heart condition, you have maybe hypertension, so you'll be having something called edema. Edema, it is a chronic thing. It's not acute. Sometimes it can be acute, but no, you've been living with this thing. Even these people who are pregnant, there are some people who have, you know, their legs, they're swelling, having edema. But with the fracture, it is a sudden thing. Yes.
And can it cause death?
Yeah, it can cause death. There are some fractures that, if they have not been treated very fast, they are medical emergency, it can cause death, because there's something called emboli.
Emboli?
Yes.
What is this emboli?
You know, in our body, there is free circulation of blood, and you know, we have the bones and the bone marrow, and the bone marrow is whereby the physiology, or is where the body manufactures this hemoglobin, the blood component and all that. But let me say there's a fracture of the humerus. You know, now there will be a clot somewhere, so there will be no circulation, so this one will affect the heart, and you can get cardiac arrest, and then you die.
And since we have talked about, you know, the fracture on the leg, you've also said the humerus. Humerus, that's the thigh, and I also know of the hand. Which other bones can have fractures in our body?
All the bones can have fracture, even the spinal, the spinal cord, all, so long as it's a bone, it can get a fracture. And
which is the most dangerous bone to break in your body?
The most dangerous bone, that's a very interesting question, but you know, all the bones are dangerous. It depends with the severity of the fracture. Yes.
So since we are saying it depends with the severity, how would you know, like, this is maybe a mild one and this is now really severe?
Okay, this one will just determine them in the hospital, but you know, in a setup, you know, at home, maybe somebody experienced or you've gotten a fracture. So what can you do? You know, when somebody you're fallen and you find that maybe the victim cannot even now move the leg, don't struggle with that leg. You need to mobilize it, I think you can
immobilize.
No more movement.
Yes.
And I think that one we need to demonstrate to our viewers so that they can
we are talking about fractures, and we've just discovered that all our bones can fracture, and they are all important. So there's like none that is mild, but it also depends with the severity of these bones, how they break, that can cause this that can make one much more dangerous than the other. And also we've learned that a fracture can cause death, because sometimes due to the fracture there can be clotting, which can affect your blood circulation and cause cardiac arrest. Now that we talked a little bit about what to do when you have a fracture, like immobilize, what really is the first step that someone should take when they have a fracture?
The first step someone should take is to you reduce the pain of this person there at home. And then, you know, people traditionally, they used to have things like stick. You tie this place, let me say this one is a fracture here, you tie it like this, and then you take a string. You remember that practice?
Not really, but I've read about it.
Yes. So that we normally do it like that to mobilize. Don't immobilize the leg or the leg, not to move. So after doing that, seek for medical help, because there's nothing. Maybe if there's a bleeding, arrest the bleeding. You can dress it. You apply more pressure, and then you take this person to the hospital.
And won't applying more pressure be adding pain?
No,
because the bone is broken and
there will be bleeding. There will be bleeding. So if they bleeding, you know this person is also losing blood. Yes.
Should we also wash it? Because with most bleeding,
of course,
as we've been discussing, we wash first.
Yeah, you can wash if there is maybe mud, or maybe this person has fallen somewhere, the place which is dirty. So you can wash the place and then you dress it. And make sure this person, you take this person to the hospital.
And is it okay to return the bone, you know, back to...
No, it's not okay. This one, returning the bone, is being done by the specialist. So take the, you know, at home, we are not specialists. Maybe you don't have a doctor or somebody who comes from any medical background. So you need just to take this person to the hospital.
Okay.
Yes.
Thank you very much. We are going to take a short break, and when we come right back, we are going to talk more about fractures, how to prevent them, how to, you know, continue to help ourselves to not injure ourselves more after the fracture has already happened. Stay with us. Welcome back to the First Aider Show. Today we are talking about fractures, and we've learned that there are two types of fractures, open and closed. And we've also learned that how to deal with a fracture is to immobilize it and give the patient a painkiller to reduce the pain, because they will be in too much pain, and then take this patient to the hospital. Joining us is a casualty that we will use to demonstrate how to deal with the fractures practically. And with me is Dr. James Okeyo, and I'm your presenter, Onyango Daisy Award. Daktari, I usually see big plasters that are put on patients who have fractures. Why is the need for the plaster?
It's for immobilization.
Immobilization. Even after they've gone to the hospital, they've taken the bone back to where it's supposed to be?
Yes, it's for immobilization, and we normally call it POP.
POP.
POP means plaster of Paris.
Why plaster of Paris?
There is somebody who came with that idea. This person is called Paris. So that we named that plaster after the person. And do all fractures require that we get this plaster? No, you know, we said that we know we have open fracture and closed fracture, and also it depends where the location of the fracture. And mostly in open fractures, we normally use plaster of Paris, whereby after doing an X-ray, and I told you closed fracture does not communicate with what?
The skin.
With the skin.
Yes.
So we just need to immobilize this leg or this place where the fracture has taken place. So we want to demonstrate something here.
Okay.
You know, this one, we want to use things reliable at home.
Yes.
This is just a carton.
So we can even use a carton to immobilize
this one is yes,
okay.
At home before going to the hospital.
Yes.
Because you know, when you just move the leg, this leg will go more
it will become
more space,
wider,
more wider.
Okay,
whichever
so how do we do this?
So what we can do, so we can just use this example, and there are some people can also use these sticks. You can bring even 3 sticks, but these cartons are always available. You can get the hard carton like this. Let me say a fracture is there in the right leg, so you just put it like this. Put it, and then you can have a string or the bandage if you have the bandage at home. If they have the bandage at home, so you try to, you can give me the support. Okay. Yes, you can. So that we just tie this leg like this. Yes, tie like this. Remember, we are just improvising a carton at home.
Yes.
And you want to take this patient or this person to the hospital. So let's say this is a fracture. This person was bleeding, so we are doing the dressing.
Yes.
So you just do like this, and this leg should not now move. Should not now move. You can give a painkiller, and you let the person go to the hospital. We take the person to the hospital. This leg
should not move.
Yes.
You know, when we are carrying our patient.
Yes.
How do we ensure that we do not interfere with the movement of this leg?
You can even get somebody just to keep it not to move.
Okay.
Yes. In fact, even if you are taking this person in the car or be it ambulance and all that, you can just carry it gently.
Okay.
Yes. And you take. And there was a question whereby you are telling me, where do you use plaster of Paris?
Yes.
We normally use plaster of Paris in mostly in closed fractures. And in open fractures, we do internal or external fixation.
What is this internal or external fixation?
Internal fixation is whereby, have you ever seen with somebody with a fracture, there's a metal, big metal, like with screws?
Yes.
So the outside one is called external fixation.
Okay.
There are screws. This one, let me say it was an open fracture. It has been reduced. That is mean reduction. The treatment, reducing is taking back the bone to the normal place.
Okay.
It is being called reduction. If there is a wound, we do debridement. Debridement means you cut all the dead cells around there.
Yes.
And then you do something called surgical toileting.
All these things are done in the hospital? In the
hospital.
Okay.
So I'm just giving common knowledge what we do in the hospital. Surgical toileting, it's whereby you wash the wound. Okay. And if it is a closed fracture, we put fracture of Paris, and I told you even a closed fracture, you can have a wound. So they normally cut a space where there's a wound, because you know this one, you will close all the what?
All the leg, the whole leg will be closed. The whole leg. Okay.
And normally all the fracture around the limbs, we put from the whole
leg, even if it's just this side. Okay.
To help the movement, not this leg to do what? To move.
Okay.
So where there is a wound, you will cut it and we open.
Okay.
So for cleaning and dressing in that place.
Okay.
Yes.
If you're joining us, we are talking about how to deal with a fracture at home, and we have learned that if you do not have sticks, you can also use a carton box to ensure that your patient's foot, if the foot is the one that has been fractured, is immobilized, meaning there should be no more movement, and you use a carton to how is it called, to support the foot, and you dress it. And if there's bleeding, you can wash before doing this, and also give your patient some painkiller because they're in a lot of pain. And for the closed wound, they use the plaster of Paris. But for open wounds, you said?
The open wound, we do internal or external fixation.
Yes, internal or external fixation. That is where you find patients with metals and metals that have been screwed in their foot.
Yes.
So how long
So
does...
let me correct you.
Yes.
What? Can you locate for me the foot?
Oh, this one?
The foot is this one. So
the leg.
Yeah, you are just right. You are just right.
Yes.
Because, you know, in a common, any layman will just use the foot, but this is limb. We have the upper limb and the lower limb.
Okay.
Yes.
Thank you for that correction.
And then there's no problem because you are just, you know, you are a layman, but you know, now you are learning.
Yes, I am learning.
Yes. And then after doing this treatment, this person, we can even, we do admit, they can even stay in the hospital for 3 months.
3 months?
Even 6 months to mobilize, just to immobilize the limb, even the lower limb or where the fracture has taken place.
Is it for only people with maybe the internal or external fixation, or even guys with plaster?
Even the guys with plasters can sometimes be admitted.
Okay.
So allow them not to move. You know, that movement is not good. Yes.
So what makes someone to stay in the hospital, you know, for 3 months and others 6 months?
For bone healing, the bone to heal, it takes some time.
Okay.
Yes. But, you know, for human being, for non-adults, for bone takes some time to heal compared to children.
Okay.
Yes.
So for children, it's faster,
it
way
heals
faster
very fast
than the adults.
Yes.
And for children, do we also apply the same?
Yeah, we do.
Okay.
Yeah, we do.
And after you've left the hospital,
yes,
when you come back home,
yes,
how do you help this person to continue with their healing process without causing further injury or maybe a reoccurrence of a fracture?
So after the management, after 3 months or 6 weeks, we repeat an X-ray to see whether calcification of the bone healing is taking place. You discharge this patient. This patient will undergo physiotherapy or occupational therapy.
After immobilization, when this patient is discharged, what are they supposed to do when they get back home to help them, you know, do not get another fracture or to speed up their recovery process? Yeah,
you know, these people, they will be in the bed for quite a number of times. Sometimes, you know, even the calls, they are specialized beds that they're being given to, we call it orthopedic beds, whereby it is improvised how they can go for long call or short call.
Yeah.
And we give them crutches to help them walk, maybe do an exercise.
And do they still go home with the plaster? Because I see some people walking in crutches.
Yeah, sometimes we can give them, because of the healing of the bone, they can go, and later they come and we remove the plaster. But we give them the crutches to go with, help them to walk. And so you have types of crutches, and we have the elbow or the armpit one.
Okay.
But I do like or advise giving the elbow crutches.
Why elbow? Isn't armpit much more easier than the elbow?
In our body or the body anatomy, we have sciatic nerve, which is just passing around the armpit. But when you use the crutches, that the armpit, they suppress the nerve.
Okay.
So it is advisable to give the elbow, the walking. Do you know the walking frame?
Yes, I know that one. My
Yes.
grandpa used one when he left the ICU.
Yes, the walking frame or a stick to walk with, depending with the support. And then after that, we need to advise them on occupational therapy and physiotherapy.
What is occupational therapy?
Occupational therapy, maybe you have a fracture
On
on the hands, or you know, you don't know, you cannot hold the what? The spoon while eating or writing. So you come, you are being trained.
Okay.
Yes, training the nerves. That is occupational. Maybe you have a fracture, you cannot speak very well, maybe it was for the neck. So you are being trained to maybe
to speak again.
To speak again. And physio is on the massage part of it, doing an exercise.
And for those who cannot afford a physiotherapist,
Yes,
what can they do at home to help them, you know, get back to the normal state?
you just walk, not a vigorous exercise. And don't forget, you know, this bone is broken, and it needs to heal very fast. We need also to give calcium supplements.
Calcium supplements. What are these calcium supplements?
So these are just food that we eat. Sometimes we have a drug which you can prescribe for a client or a patient to go and buy. But we can get calcium even in the food that we eat, like fish or the daga omena. You know omena?
Yes.
Yes. That one, we can get calcium there.
So this one applies for both adults and children?
Yes.
Okay. Thank you very much. This has been the First Aider Show, and we were talking about fractures, and we've learned that the first thing someone should do is immobilize the patient. And immobilization is done when you can use a carton box in the house if you do not have a stick, to ensure that the bones do not move. And you give the patient painkillers to help reduce the pain, and then take them to hospital. And after they've left the hospital, when they get back home, they need to do occupational therapy or physiotherapy, right? Yes,
and
to help
calcium supplements.
And calcium
supplements. And remember, you can even get calcium in milk.
Oh, in milk?
Forget, yeah. Okay. There's a lot of calcium.
You can also get calcium in milk, fish, omena, to help you get back to your normal state.
Yes.
Thank you for being with us. See you next time.